Good morning, members of the media. Thank you so much for joining us. If you have a question for each of the members, they'll take them after they all speak. You can do them in two ways. You can raise your hand and we'll open your mic and you can ask a question, or you can write it in the Q&A box and I will read your question verbally. Again, please let us know what media organization you are with. We will start with Congresswoman Wasserman Schultz.
Thank you so much, Mike, and thank you all for joining us today. We're here today to discuss the American Rescue Plan, which will get a final vote in Congress tomorrow, and how it will get America firmly back on track, and specifically how it boosts our vaccination efforts across the country. But we also want to touch on the troubling COVID response efforts taking place here in Florida, especially regarding vaccine distribution. First, I'm extremely pleased that we are about to deliver desperately needed relief to American families this week with final passage of President Biden's American Rescue Plan. This plan will save lives by ramping up the deployment of testing and vaccines and making sure that we can finally slay this virus. This plan will also help small businesses and schools safely reopen in a much swifter timeframe. And it will be what we all ultimately want, of course, because we've been pushing for this for so long. There's nearly $130 billion in K-12 school aid included in this bill to help make that happen. The bill also provides housing, unemployment, and direct relief to those families who need our help until this economy can fully reopen. Individuals will receive $1,400 on top of the $600 down payment that they received in December, and that'll help pay some overdue bills. Sadly, we've been under this deadly pandemic cloud for a year now, and we won't eradicate it overnight, but we're getting closer. And while we work on that, we will also direct assistance to towns, cities, and states so they can keep first responders on the job. America needs this help, and this is the best upfront investment we can make right now to have a full and robust recovery later on. Even though we can see the light at the end of the tunnel, we can't begin to fully reopen our economy until we get more Floridians vaccinated and eliminate the risk of harm from this virus. And that's exactly why we put over $20 billion into establishing a national COVID-19 vaccination program that will improve the distribution of vaccinations and make sure that we can put $51 billion into expanding testing, contact tracing, and mitigation. These are all common sense investments, and that's something nearly all Americans understand needs to happen. While unfortunately no Republicans in Congress voted for this bill so far, a strong majority of Americans support this bill and the overall effort that Democrats and President Biden are making to eliminate this virus. For instance, overall, 70% of all Americans support Joe Biden's virus response, according to a recent AP poll, including almost half of all Republicans. A big part of that is the popular American Rescue Plan itself, which a Morning Consult poll recently showed has 76% of Americans supporting it. But another key element of the overall federal relief response that people really like is the transparency and coordination we're seeing right now, especially from the White House. While some governors never adopted mask mandates, like Governor DeSantis here in Florida, governors in other states are foolishly rushing to lift theirs now. And as the Biden administration has stressed, we cannot stop doing the smart things that got us to this good spot to begin with. That's not what Americans want to hear, I know, but it's true. And this is what the experts said we need to do. So President Biden is rightfully stressing that we still need to wear masks in order to continue to protect our community, our neighbors, and our family. From top to bottom, the federal government is dealing with this pandemic in a smart, forthright manner now, and in a way that treats all Americans like adults and with equity and respect. I know I saw it myself this weekend at the Miami FEMA vaccination site. For starters, officials there acknowledged in a transparent way where we are failing right now to reach underserved and vulnerable communities, especially communities of color. The facilities that I toured were just part of the outreach taking place. And just as important, mobile units are going directly to the Black and Hispanic communities that unfortunately have been neglected by the state of Florida. The event itself was efficient and well run. Attendees were kept out of the sun and given wait time estimates, and they were provided water. And they were also able to sit in a chair for the entire process once they got into the tent, and the outside line was very quick. I really was so impressed with the overall process. And one of the things that was really important that I learned while I was there is that they are adapting to various things that crop up on a daily basis. For example, in the beginning, when they first opened the site, officials were requiring only the form that the state has issued. But then they realize that there are a lot of folks that don't have access to a computer who might be coming there to get a vaccine, and they wouldn't be able to print out the form. They're just able to go to their doctor and get a doctor's note. So then subsequent to that, they started accepting doctor's notes as well, because they want to make sure that they're not turning people away. And when people have made the effort to get their vaccine, that they can get it, particularly if they fall into the categories that are eligible right now. It was really the way a vaccine site should be run, professionally, equitably, and in a well-coordinated and responsive manner. Contrast that with the vaccine rollout under Governor DeSantis, which has been marked by favoritism, frustration, and confusion. There has been little to no transparency from the state, and the coordination is so lax, it's not clear Florida really knows where vaccines are going. For instance, Publix is deciding without any direction from the state of Florida how vaccines are distributed. And state officials didn't even know where they would end up for sure, according to the Miami Herald. From the beginning of this pandemic, DeSantis played down the threats, cooked the COVID books to make it all look rosier, and retaliated against anyone who dared to question his methods. In recent weeks, we found out that DeSantis had set up invite-only vaccine clinics in upscale communities, allowing them to jump ahead of thousands of others. And now it's being reported that a donor connected to the invite-only vaccine clinics dumped tens of thousands of dollars into the governor's campaign coffers. Again, when he's been questioned about this, her first instinct has been to retaliate and say, "You got a problem with that? We'll pull the clinic and put it elsewhere." Over the weekend, his denial of state involvement in these invite-only events was contradicted by hospitals and county officials. So with DeSantis, the reflexive response is retaliation or misrepresentation, or just flat out lying. And this is no way to earn people's confidence and trust amid a pandemic. We already have vaccine hesitancy in many communities, and we need to make sure that we are being transparent and equitable and efficient and well-coordinated and responsive. And DeSantis's behavior is the kind of reckless behavior that costs lives. This week, we're going back to Washington, and we're going to deal with this and approach this pandemic with science, clear coordination, and transparency. That is how we will defeat this virus and get America fully back on its feet. And now I'd like to introduce and turn the mic over to my colleague and friend, Congressman Charlie Crist.
Thank you very much to my colleague, friend, and fellow appropriator, Chair Debbie Wasserman Schultz, for the introduction, and thank you all for being here today. I think I speak for my colleagues on this call when I say that we take no pleasure in Governor DeSantis' handling of this pandemic. But the fact of the matter is that we are past the one-year mark of this virus in our country and Florida, and still have no concrete vaccination plan for the Sunshine State. For months, we knew the vaccine distribution was coming and that our state would need a plan in place that would target distribution, that would then ramp up to mass vaccination as supplies increased. At the very least, we needed clear, transparent communication between the governor's office, local hospitals, county officials, and yet what we've got was the complete opposite. The least transparent administration of my lifetime. Political pop-up sites in wealthy gated communities, so the governor's friends and donors could jump the line in front of every other senior. And still no plan, no guidance. Seniors waiting out in the cold or heat, leaving it up to individual doctors to determine high-risk status. Give me a break. This just doesn't make sense. Seniors are still struggling to get online, to get someone on the phone, or who can help them get a vaccine appointment. It's total leadership failure. You shouldn't need to know somebody to get an appointment. We saw this with the unemployment situation, and now we're seeing it with our vaccines. Governor DeSantis is shooting from the hip with the health and well-being of Floridians literally on the line. No leadership, no responsibility. When you muzzle your Surgeon General, you arrest your scientist who is trying to report the truth, something's terribly wrong. And it didn't have to be this way. Thanks to the investigative reporting across the state, including many of you, Floridians are beginning to learn the truth. The governor's friends, allies, and donors get to skip the line. Meanwhile, who is looking out for the hardest hit communities in our state, especially Black and Latino seniors? It is literally unconscionable. Hospitals and county health departments with no clue of what Tallahassee is doing and how to distribute these doses. Publix is doing a better job coordinating vaccines than our own state government. And CVS and Walmart, thank God, are ignoring the governor's latest confusing directive and just following the Biden administration's call to vaccinate all teachers. What better way to keep schools open and safe than protecting our teachers? The DeSantis plan, or lack thereof, stands in stark contrast with what President Biden has been doing since day one. With his leadership and willingness to use the Defense Production Act for vaccines, President Biden moved up the timeline from late July to late May to get everyone vaccinated. Do you know what this means? 2 more months of freedom, of summer, of lives saved, because we finally have competent leadership at the top. Add in the American Rescue Plan, shots and checks, plus relief in small businesses, state and local governments, and aid for those hit the hardest by this pandemic. We are going to take what it needs to be done to get every shot in the arm of every American that wants one. Get our economy back on track and crush the virus so we can get our lives back to normal sooner than later. This is a plan that meets the crisis we're in and finally gives Floridians the leadership they have been lacking and frankly deserve. I'm an optimist, and like many of you, I see a light at the end of this tunnel, but we're only going to get there by working together. We all need shots in the arms of all folks who want one. That means when it's your turn, get your vaccine. Your loved ones and our community deserve it and need it. Thank you all, and God bless you.
Thank you so much, Congressman Crist. Congressman Soto?
Thank you so much, Representative Wasserman Schultz, Representative Crist. We know the American Rescue Plan will provide desperately needed relief to Florida, and not a moment too soon. Our FEMA community vaccination sites, along with state sites, are moving at a breakneck pace, with over 3 million Floridians being vaccinated to date. The fact still remains, though, that Florida has over 21 million residents, which means about 86% of our residents still need to be vaccinated. On the current pace of about 40,000 residents per day, it would take us 15 months to vaccinate Florida. Our constituents and our economy can't wait that long. I spent a few hours, an hour and a half, and specifically on Sunday at the FEMA vaccination site to wait online with my wife, Amanda, who's an educator. And it was very efficiently run. So it's not the federal sites, it's the confusion we see in the state sites where many educators didn't know whether they were eligible or not. Many were turned away. We need clear and consistent eligibility requirements like we see on the federal level, on the state level as well. If we're going to continue to reopen our schools safely, all educators need to be vaccinated. We also need the resources for extra efforts for hard to reach populations like our Hispanic community and African American and rural communities throughout my district. Many of those communities lack access to adequate internet. Many of them have waited for hours on the phone to try to register. And so these walk-up sites like the FEMA vaccination site, where you don't need an appointment, it's key to level the playing field along with additional transportation assistance for those who are immobile. The American Rescue Act will supercharge these efforts at a scale and with the resources that we need to get most Floridians vaccinated before the end of this year. In Central Florida, we're still dealing with high unemployment as well, hovering at 7% in Orange County and over 8% in Osceola County. We all know our tourism and service industries have been hit particularly hard compared to other industries. Central Florida families need unemployment, food, housing, and small business assistance. And we need it extended until our industries can recover later this year so that no family goes hungry, so that no family is kicked out in the streets. Stimulus checks, child tax credits, and earned income tax credits will help particularly our families with young children who need our help the most. We will continue to work to help Florida's working families through the pandemic and into the end of this economic crisis. That's what the American Rescue Act is all about. And not making sure that the institutions and vices of the past persist, but that we could build back better and make sure that we're helping out those who need the help the most. Lastly, our real estate market collapsed during the Great Recession. We saw the lessons of the American Investment Act, that we didn't go big enough. Thousands of Central Floridians lost their homes. Many others saw their biggest nest egg, our seniors and other folks who didn't even have housing trouble, lose billions in equity. And we still have not fully recovered with the amount of home ownership we had pre-Great Recession. We're not going to do this again. We're going to learn from the past, and we're going to go big with the housing assistance that's needed to make sure Central Florida's housing market remains stable. And we protect the nest eggs of so many seniors who are counting on that equity, as well as to protect the houses of so many Central Floridians who work every day and are only not working right now, and to a certain extent because there's no jobs to go to yet. We can do this together when we pass the American Rescue Plan this week. Well-needed relief for Central Florida and for all of Florida is on the way. Thanks, Debbie. Thanks, Charlie.
Thanks so much, Darren and Charlie. And Mike, I think we're ready to open it to questions.
Before we get to questions, once again, if you do have a question, please raise your hand or write it in the Q&A box and I will read it out verbally. Our first question is from Wendy Rhodes with the Palm Beach Post.
Hey, Wendy.
You might be muted.
Wendy, you have to unmute yourself.
Okay. Yeah. Ooh, Monday morning. Okay, question. DeSantis and Wilton Simpson have both suggested that we use a portion of the money that's going to be coming to Florida from the federal fund. Apparently, like up to $2 million was floated to replenish the unemployment fund to avoid increasing taxes on corporations. So my question is twofold. First of all, my understanding is Florida is expecting about 16 to 17 billion from the stimulus. I wanted to verify that number or see what the correct number is. And then I was hoping, as many of you who would like to, would comment on whether or not you support that idea.
Well, I'll start off in saying that no, I do not support the idea. In fact, when I saw the report that was the direction that our legislative leadership in the state was heading, I have my own team checking on whether or not those funds can be used to help businesses avoid a unemployment tax increase. The assistance to state and local governments, which, by the way, Republicans aggressively opposed, every single Republican in the state of Florida voted against the American Rescue Plan when it initially passed the House. I bet that tomorrow all of them will vote against it again. But the purpose of those funds is to make sure that we are doing things like helping states and local governments not lay off first responders, making sure that while yes, they can replace general revenue that has been lost as a result of the downturn in the economy, it wasn't to let them swoop in and help businesses where we are already one of the worst states in the country for unemployment benefits, for the length of time that we provide benefits. We shouldn't be giving businesses a windfall. What we should be doing is making sure that we use those funds to increase the weekly amount for unemployment benefits, lengthen the amount of time past 12 weeks when they can go up to 26. I mean, unfortunately, the reflexive response of Republicans is always to help business and screw the little guy. And I'm just so tired of it. And so I'm making sure that that this is a permissible, allowable use of those funds, and just going to be underscoring to make sure that that it's people that are hurting here, and that we make sure that we can take care of them.
Wendy, I'll take a stab at it. This is Charlie, and thank you, Debbie. I couldn't agree with her more. These funds, and I have some experience in this area, as have my colleagues. Back in 2009, when we had what was called the Great Recession, nothing great about it at all. We had the opportunity with the Democratic administration of President to have an opportunity for Florida to receive in excess of $12 billion at the time. And Wendy, I think you posed, is this 16 or 17 billion? Well, it's been reported it's something north of 16 billion. I think most of us have read that in news accounts as well as the bill itself. But, back in 2009, the point was to save, as Debbie said, teachers' jobs, law enforcement jobs, firefighters' jobs, these first responders who do so much for both our children and our communities. And that's where it was targeted. It was targeted to hardworking Floridians to have the opportunity to maintain their employment in order to both protect us and teach our children. This is really no different. It's the same kind of model. Not surprisingly, President Biden was the vice president at that time. And so you're seeing a consistency of leadership, I believe, that understands that real Americans, blue collar Americans, need to be protected the most when you're dealing with a crisis like this. It is not the wealthy who really need that much help, frankly. And God bless them. I have nothing against people having done well in their lives. That's wonderful. But the reality is we're in an international crisis right now. And we are experiencing that crisis firsthand in Florida. And the point of this rescue, it's a rescue plan. I mean, it is well titled. It's not some bumper sticker thing. It is to rescue our people, our fellow Floridians, and make sure they have the opportunity to maintain their employment, to be able to feed their families, to be able to pay their rent and their mortgages, and get on with their lives and get this pandemic behind us, hopefully sooner rather than later.
Just to add, we've already provided ample small business and business relief in the past 4 acts, whether it's the Paycheck Protection Program, where there's the industrial fund for major companies, or whether it's the EIDL loans. So and many of these are forgivable if people simply pay 60% of those loans to their payroll to keep people employed. So we've already provided ample relief. I think the most obvious use of these funds are some of the things we've talked about. But first, it's expanding Medicaid, because we finally made it easy again for Florida to do it, and they're going to have the money to do it. And it's time to cover everybody during a pandemic and finally get this done with. This is a golden opportunity to make sure that we could cover all Floridians now at a time when they need it most. And then, of course, it's for keeping our heroes on the job. We're in a pandemic. This is about the response. And it's also about all these families throughout Florida who are hard hit: food, housing assistance, unemployment assistance. Instead of dropping taxes, why don't you just keep them the same and raise the benefits? Because we know that that's going to get our economy back quicker. So this is about a new vision of making sure that we could work first and prioritize Florida's working families, knowing that we have ample business relief that's already coming through from the federal government.
Mike, next question.
Our next question is from Alex Daugherty with the Miami Herald.
Hi there. I wanted to just follow up on something I think Congressman Crist mentioned. He talked about the vaccine plan giving Americans 2 more months of freedom with the move up of the timeline from May to July. I'm just curious, in your mind, to all of you, what the level of quote unquote freedom may look like if we're looking at like a May date of everyone who wants a vaccine being able to get it. What in your estimation and in conversations you've had, what will we be allowed to do and what we won't be allowed to do? And I'm also curious if you all have talked with any local Republican officials about this rescue plan. I know your House colleagues don't support this bill, but have you talked to local mayors or other officials about what this plan may do, and what has their reaction been?
This is
Debbie, you
Debbie.
want to kick it off?
Yeah, sure. I'll kick it off briefly and then kick it over to you. The American Rescue Plan is focused on trying to make sure that we can cover all kinds of different really critical issues, like reopening schools safely, making sure that we can help local governments and state governments address first responders. Congressman Soto just mentioned a really important thing that our state could do by putting resources into expanding Medicaid. But as far as the actual day-to-day changes in people's lives, once we get the vaccination plan up and running and everyone that wants a shot, that's an adult, by the end of May is able to get one, those decisions are going to be driven by science. That's how Democrats do things. We're looking to the CDC to release guidance on what you can do even now as people are getting vaccinated. What comfort level do people have in being able to get out there? My understanding is that masks, likely until we have herd immunity, will still be necessary for us to keep one another safe. But circulation certainly will be much more significant. But those decisions rightly should be guided by science. And I know I'll be waiting for the guidance from the Centers for Disease Control on once we have vaccination, widespread vaccination as a result of the American Rescue Plan, what movement it will be allowed, or what movement will be safe.
Great. Thank you, Debbie. Alex, to your question, have we talked to mayors and colleagues and, Republicans across the aisle? I engaged with one of my Republican colleagues in the Congress in Florida yesterday. I'm always in contact with Mayor Kreisman in St. Petersburg, Mayor Castor in Tampa, and others. You asked about the timeline. Would it be past us by May? Will we have 2 additional months of greater freedom and more flexibility and more normalcy, frankly? It's hard to say and predict that for sure. And, I'm just being honest. And the reality is, we don't know whether spring break, for example, is going to create a super spreader situation. I saw my friend and Mayor Dan Gelber concerned about what would happen in Miami Beach and South Florida in general, frankly, throughout the state. People come from everywhere to spring break here. So that's one unknown that we'll be facing in the near future. In addition, how much more leadership can we expect out of Governor DeSantis? Will he finally say it's a good idea to wear a mask statewide instead of, county and city leaders, municipal leaders having to invoke that on a, case by case basis, if you will, around the state, instead of singular focused leadership from the top? Encouraging, social distancing, doing the things that are right, instead of going to the Super Bowl and not wearing a mask as he did. I went to the Super Bowl, I wore a mask and it about drained my bank account. But it was worth it. But you got to do it the right way, and you can't set a good example by him sitting up in a box. I was in the stands, but him sitting up in a box, the leader of our state, not wearing a mask. I mean, come on, that's not what Joe Biden does. It's not what Kamala Harris does. It's not what Debbie Wasserman Schultz does, or Darren Soto, or myself. I'm alone in a room, so there's nobody within 6 feet of me. But, it's that kind of leadership that we need to calculate in this situation. Are we going to have a super spreader? Can we have better leadership from Tallahassee? And we haven't yet, and I don't expect it.
I have spoken with and attended school board meetings in the district. We've seen our county commissions throughout Orange, Osceola, and Polk counties utilize these funds in a bipartisan way to help crush the virus and provide meaningful relief. But I know particularly our schools, where we have bipartisan school boards in all 3 of the counties I represent, are desperate for these funds. And with regard to the direct relief, now we have it where even counties under 200, up to 200,000 folks and above are eligible. We see in Osceola, they'll get 73 million. Orange will get 270 million. Polk County will get 141 million under the American Rescue Act. And I know we've seen broad support to use these funds. Maybe not everybody, says happy day when they see us pass it, but they sure make good use of it in our constituents, which is really what matters the most. Our constituents want this to happen. We're talking over 70% support everywhere I go. When I talk to small business owners and when I talk to folks in firefighters and cops, folks who are Republicans, who are Democrats, who are independents, Florida's working families want relief. They know where we're at. They know it's a dual crisis, where we have a pandemic and an economic crisis. And it's not as partisan among the general public as you see in the House and in the Senate. And overall, it's more partisan in the Beltway than it is on Main Street. And we're going to see over the next couple of months, this bring us back to prosperity, bring us back to health. And that's where people will fully realize from the beginning in Washington, they made a critical error to oppose this when the American people want this. It's pretty clear.
Okay, our next question is from Christina Vasquez from Local 10.
Hi, good morning. Can you all hear me?
Yes.
Oh, perfect. Thank you for your time. So one thing I'm looking at today is the one component of the COVID-19 relief bill that is the funds dedicated to local municipalities. And so I was hoping you could flush out a little bit more. From what I understand, unlike the federal government, local municipalities do need to balance their budgets at the end of every fiscal year. And according to the National League of Cities, there was some concern that as we approach the end of this fiscal year, municipalities across South Florida could be seeing everything from layoffs to, cities have to we're thinking about how are they going to bump up earned revenue, right? So for a municipality, that could be everything from property taxes to your alarm permit fee. So all of that trickles down, right, to folks. So I was hoping you could help kind of flush that out a little bit from your all's point of view. How does that aid to states and cities really trickle down to an impact to the everyday resident in terms of helping them with what has been such a substantial impact to city and county coffers?
Sure. Especially in a state like Florida, where we don't have an income tax and we rely primarily for general revenue on the generation of our sales tax. When you have a massive hit to the economy like we have during COVID-19, just like we did in the Great Recession, you obviously have this this trickle-down effect where the state obviously has brought in less general revenue, and so they have big holes in their budgets. By the way, the state government also is required to balance the budget. They can't they can't deficit spend, as well as local governments. And so when you have huge hits to that general revenue, the local sales tax that flow to municipalities, state, local budgets, that they end up being forced to scramble either by cutting their budget or raising taxes and fees. And this revenue that will flow, and now that we are giving it, we dropped the size of the county that's going to be able to get direct assistance, and we're also being able to get direct assistance to more local governments. They're going to be able to use the revenue from the American Rescue Plan to fill those budget holes, avoid layoffs, make sure that they can maintain the services that their people need, and ensure that they can, for example, take care of their residents and their local businesses. And it helps them make sure that they don't have to find other ways to fill those budget holes. By the way, this is a really important question related to what you should be doing with your with the general revenue, the money that's going to flow from the American Rescue Plan, and what you should not be. The state government, their response to getting money that, by the way, again, Republicans oppose having Congress appropriate, should not be used to avoid a tax increase for that is automatic in the state law when it comes to unemployment insurance. What they should be doing is making sure that they can put that money into the benefits that workers need, because just because they help a business avoid an unemployment insurance tax increase doesn't mean that business is going to hire back their employees. So ensuring that people have the resources that they need when they've lost their job, which is what unemployment insurance is, as a bridge to when they gain employment again, that's what these resources are for. It's not to give a windfall that would automatically occur when you have a depletion in our unemployment insurance fund, insurance compensation fund, and not make sure that people can have that bridge and that safety net underneath it.
Well, I think it's hard to add to that great recitation we heard from Debbie. It's important to understand that what's happening here, Christine, is whether somebody has compassion and empathy, or if they're more geared toward, reducing the taxes of, a business corporation. This is called the rescue plan purposely. The governor opposes rescue. We and I support rescuing our people. So there's a clear distinction in terms of attitude and what we have our eye on as it relates to how do you solve the crisis and how do you really help everyday people, as you called it, Christine. Another way, obviously, and I know this isn't directly what you were looking for, but the $1,400 check is going to help a lot too, to regular, ordinary people throughout our state and our country. Let us not forget that. I think it's just real important that, people know what this is for. And again, I don't mean to be repetitive, but I'm going to be repetitive because experience does matter. And all three of us have had the experience of going through that Great Recession. And we understood what the $12 billion then was for. It was to help people. It was to help people. And it wasn't to cut taxes. Listen, there's a time to try to reduce taxes and be compassionate in that way. No question about it. Kind of like reducing property taxes was. And property insurance. They were kind of a double barrel nightmare when I served as governor in the past. And And all of us on this call helped us get through that, frankly. And I'm grateful to my colleagues for that. And you know, I wish that this governor would understand that this is a time of empathy, a time to be compassionate. And I think that's why we're getting such great leadership out of President Biden and Kamala Harris. I mean, who's been through more struggles in his life? I mean, a lot of people probably have, but my goodness, what he's had to live through, losing his first wife in an automobile accident, his daughter, losing his son. You know, they say about a parent, you should never lose a child, you know, and he's been through that. So he has a heart for this. And, you know, we've had 4 years of not much heart in the White House, and now we have it back. And thank God for that. And giving us this rescue plan that we are going to get to vote on again, and hopefully get it passed by tomorrow, and then get it on the president's desk this week. And I think from what my colleagues have said, both Darren and Debbie, the American people support this by over 70%. And Debbie made a good point that I got in a note. The total, and correct me if I'm wrong, Madam Chair, $17.3 billion to Florida because of this plan. Thank God, literally.
Last thing I'll add, we're in a pandemic. EMTs, nurses, firefighters, cops, and teachers are on the front lines. They're the ones rescuing Floridians. They're the ones putting shots in arms. They're the ones teaching our kids. We need them all on the job, on that front line, so that we can recover. Cuts in these areas just will mean lives. It'll mean more folks getting sick, and it'll be a longer recovery. And God knows every Floridian wants to recover as soon as possible from this pandemic. And I have to head out to a flight. Thank you, everyone.
Thanks, Congressman Soto.
Thank
Mike,
you, Darren.
next question.
We have a written question from Steve Litz from NBC6. Can the members please discuss how the American Rescue Plan is also aimed at helping children? Monthly payments to help lift kids out of poverty, parents entrusted to earmark those dollars for their kids.
Charlie, you want to take that first, or I can?
Yeah, I'll give it a shot. I mean, you know, childcare is important. That's part of this plan. I think that's going to help. You know, supporting teachers in the classroom is going to obviously help children. You know, I think, you know, having the $1,400 that go to make up the balance of what was left from the prior plan that we passed, frankly, that Debbie and I and Darren passed last May, but we're finally getting to it now, thank goodness. And, you know, so there are many ways this is helping children. This is helping all people. This is helping everybody. This is doing what's right for our country, for our state, for our people. You know, a great president once said that our government should be of the people, by the people, and for the people. Well, this plan is exactly that. This is to help people. And, you know, I don't know if you can see them, but I wear these yellow wristbands every day. And it simply says, practice the golden rule every day. The golden rule. Do unto others as you would have done unto you. That's what this plan does. That, you know, if you're somebody who's bagging groceries at the local Publix, you know, in Miami Springs, you know, this is the kind of plan that touches you, touches your family, helps people, rescue them from the crisis that we're in the middle of. You know, what could be better? What could be more smart? And Steve, thanks for the question.
Steve, let me just drill down on exactly how the American Rescue Plan helps children. This is a bill that will provide historic assistance to children and to families in poverty. The American Rescue Plan will literally cut child poverty in half. What it does is it takes the child tax credit from $2,000 to $3,000. It actually goes to $3,600 for children under 6 years old, and it makes it fully refundable. What fully refundable means is that instead of you getting that money at the end of the tax year, when you file your tax return, it makes it so that that money is spread out over the course of the year in monthly payments, so that a family has access to that kind of those kinds of resources for each of their children to be able to make sure that they can be pulled out of poverty and be able to improve the quality of life of their families dramatically. It is historic, and it's been something that that child advocates have been pushing for years. You know, legislation that I know myself and Congressman Crist, Congressman Soto have supported for years, and we were able to make sure that that was included in this bill, because if there is any time that families need this kind of assistance and need the opportunity to be able to get firmly on their feet going forward. It is in the midst of this pandemic that has devastated the economy, particularly for people who are already struggling.
Okay, again, if there are any questions, please raise your hand or write them in the Q&A box. Seeing as there are no more questions, thank you everyone for attending today.
Thanks, everyone. Appreciate you
Thanks,
joining us.
Thanks, everyone. Thank you, Madam
Howard,
Chair.
CNBC.
God bless you.
Take care. Bye.
You bet. Fly safe.
You too.
Thank you.